Hello, my name's Sophie and I work for the East Sussex Sexual Health Service. There's a type of contraception called emergency contraception that can be used after you've had unprotected sex or your normal contraceptive method has failed, and this will prevent you from getting pregnant. If you don't know what emergency contraception is, it can be called the morning after pill. But this name can be a bit misleading because you don't actually have to access emergency contraception the day after you've had unprotected sex. It can actually be accessed up to 5 days after. It's most effective if you can get emergency contraception the closest to the unprotected sex that you've had, but please don't feel worried and rush out and pay £20 to £30 for emergency contraception, because you can actually access it for free at various different locations across East Sussex. For example, you can order it online for free via our website www.eastsussexsexualhealth.co.uk. You can collect it from some pharmacies and you can always collect it from a sexual health clinic. There are two methods of emergency contraception, a type of pill and the IUD. There are two pill forms of EHC. The first is Levanel, most effective within 72 hours. This type of emergency contraception contains a progesterone hormone. This cannot protect you from any further unprotected sex and may cause side effects such as feeling a bit dizzy or tired after taking it. You may get headaches, breast tenderness, abdominal pain, vomiting. It may disrupt your periods for a while and cause irregular bleeding patterns. The second pill form is called Ella-1 and can be used up to 5 days after unprotected sex. This works by stopping progesterone, a hormone women produce in their ovaries, from working normally and prevents pregnancy by delaying or preventing ovulation. If taken within 5 days, 120 hours of having unprotected sex, it is almost 98% effective at preventing pregnancy. This cannot protect you from any further unprotected sex and may cause side effects similar to Levanel. Both of these emergency contraception methods I have just mentioned should not be used as your regular form of contraception. Please only use these methods if your normal contraceptive method has failed or you have had unprotected sex. The third type of emergency contraception is the IUD. The IUD is the most effective method of emergency contraception. The IUD is a small plastic and copper device that is fitted into your uterus by a specially trained doctor or nurse. It is over 99% effective, but it needs to be fitted within 5 days, 120 hours of unprotected sex, or up to 5 days after the earliest time you could have released an egg. After having the IUD fitted, you can continue to use this as your usual method of contraception. If you are accessing emergency contraception, please ensure that you also take an STI test kit too. The methods that we've just spoken about may prevent you from getting pregnant, but they won't stop the spread of STIs which can be passed on from unprotected sex. You could order one of our self-test kits, and if you visit our YouTube channel, you can see exactly how to order it and how to take the test. Please note that it can take up to 2 weeks for the infection to show in your system, but as some STIs show no symptoms at all, it may be worth you taking a test when you collect your emergency contraception and then in 2 weeks' time when you're taking your pregnancy test. Please don't forget that you can collect emergency contraception for free at various different places across East Sussex. All you have to do is visit our website www.eastsussexsexualhealth.co.uk. Select that you're looking for emergency contraception, put your postcode in, and it will highlight the nearest location where you can go to access that information.